Welcome to Lung Point of Care Ultrasound, Module 1, The Basics. My name is Mark Owen, and this is my Doctor of Nursing Scholarly Project. And I just want to say thank you for taking your time and your energy to help me complete this. This is the first of a 4-part series designed to help the advanced practice provider, the APP, such as nurse practitioners and physician assistants, as well as the APP student, to improve their knowledge and skills in the use of lung POCUS to diagnose pulmonary edema, pneumonia, and pneumothorax. The goal of this Doctor of Nursing scholarly project is not to make you an expert, but to awaken an interest in lung POCUS and to give you a basic sense of what it can do. The objectives of Module 1 are listed on this slide, and they include define frequency, identify typical frequency ranges in POCUS, describe and understand POCUS, define the 4 types of echogenicity. In order to define frequency, it helps to understand the sound wave cycle. Sound, similar to light, when it is emitted from a source, travels in waves forming peaks and troughs. Each peak to peak, or trough to trough, completes one sound wave cycle. In ultrasound, frequency refers to the number of sound wave cycles per second. For example, 1 sound wave cycle per second equals 1 frequency, or 1 hertz. 10 sound wave cycles per second equals 10 frequencies, or 10 hertz. And 100 sound wave cycles per second equals 100 frequencies, or 100 hertz. The length of the sound wave cycle affects frequency. Longer sound wave cycles have lower frequencies because less sound wave cycles are completed in 1 second. Shorter sound wave cycles have higher frequencies because more sound wave cycles are completed in 1 second. The term ultrasound refers to frequencies above the normal human audible range. Humans can hear frequencies between 20 and 20,000 hertz, or 20 to 20,000 sound wave cycles per second. In comparison, dogs hear frequencies that fall between 67 to 45,000 hertz, while cats hear frequencies of 45 to 64,000 hertz. Bats who use sound waves to help navigate and to detect prey hear frequencies between 2,000 and 110,000 hertz, or 2 to 110 kilohertz. Diagnostic medical point-of-care ultrasound uses frequencies that range between 1 million and 15 million hertz, or 1 to 15 megahertz. Clearly, point-of-care ultrasound uses an excessive number of sound wave cycles per second. But what exactly is point-of-care ultrasound, and how does it work? Point-of-care ultrasound, or POCUS, has been defined by Sony et al. 2020 as a goal-directed bedside ultrasound examination performed by a healthcare provider to answer a specific diagnostic question or to guide the performance of an invasive procedure. POCUS uses high-frequency sound waves to help the provider answer a yes or no question, or to rapidly rule in or out an acute, potentially life-threatening pathology. In POCUS, a handheld transducer is placed firmly against the patient's epidermis, or mucous membrane-lined body cavity, and sound waves of 1 to 15 megahertz are emitted. As the sound waves travel away from the transducer, they are reflected, refracted, scattered, transmitted, and absorbed by different body tissues, depending upon physical properties, or the echogenicity of the body tissue. The returning echoes are then captured by the handheld transducer, interpreted by the ultrasound computer, and an image is displayed on the ultrasound monitor. Because sound scatters at air tissue interfaces, places where air and human tissue meet, like the surface of the skin, a liquid medium, also known as ultrasound gel, is typically required to form a seal between the ultrasound transducer and the patient's body so that sound waves can penetrate the surface. Briefly mentioned on that last slide, echogenicity is an important concept in ultrasonography. Echogenicity refers to how reflective, how dull or bright a particular body tissue is to sound waves, especially when compared to surrounding structures or tissues. Echogenicity has 4 subcategories called anechoic, hypoechoic, isoechoic, and hyperechoic. Anechoic tissues or structures transmit all sound waves without reflection and appear black on POCUS. Examples of anechoic tissue include fluids, blood, bile, and urine. So looking over here on this picture, as you can see, this is the liver, and inside the liver are these little black circles. These are anechoic blood vessels, which do not reflect sound. Hypoechoic tissue reflects more sound waves than anechoic, but relatively fewer than surrounding tissues or structures do. The renal cortex, relative to the liver, would be an example of a hypoechoic tissue. So again, looking back at this picture, as you can see, this is the kidney, and this is the liver. And this region right here is the renal cortex. As you can see, it reflects less sound waves than surrounding structures. But it's not anechoic because it's still, if you look closely, you can see that it does actually reflect sound. Isoechoic tissues or structures reflect sound waves comparable to surrounding structures or tissues. Isoechoic tissues often appear as shades of gray and are commonly seen in solid organs, soft tissues, and muscles. Again, looking back on this picture, as you can see, the liver, other than the anechoic blood vessels, is relatively consistent with itself. There are different little shades of gray throughout, but it's essentially the same. This would be an example of isoechoic tissue. Again, on the other side of this diaphragm, you can see lung tissue, and it is relatively the same consistency, just a few shades of gray. This also would be considered isoechoic tissue. Hyperechoic tissues or structures reflect most sound waves and appear bright white on ultrasonography. Calcified, fibrous, or dense structures, such as the diaphragm, pericardium, and lung pleura, appear hyperechoic. And right here is an example of the diaphragm and of hyperechoic tissue. Some structures, such as bones, are extremely hyperechoic, and they create shadows due to an almost total reflection of sound waves, which often prevent the visualization of underlying structures. Point-of-care ultrasound technology is pretty cool, but why should the APP care to learn it? Well, for one, it's kind of like the stethoscope of the future. And for another reason, it's an effective tool for the assessment and diagnosis of multiple pathologies, including those that affect the heart, the abdomen, the eyes, the joints, the bones, and especially so, the lungs. In fact, POCUS has several advantages when compared to other diagnostic modalities of the lungs. For one, POCUS is accurate. For the acutely dyspneic patient, POCUS is more sensitive than a stethoscope at detecting the underlying pathology. POCUS has superior diagnostic accuracy than a chest X-ray, and it's virtually the same as a CT scan. POCUS is especially effective at identifying pneumonia, acute pulmonary edema, and pneumothorax, and it can strongly suggest a COPD patient or a pulmonary embolism. POCUS is safe. POCUS is safer for the patient than a chest X-ray or a CT scan because it emits sound waves and not ionizing radiation. It is this fact that allows serial POCUS exams to be performed without additional harm to the patient. Furthermore, POCUS can be performed on those patients who are too unstable for a chest X-ray, for an MRI, or a CT scan. POCUS is also timely. Point-of-care ultrasound can be done in less than 5 minutes, whereas a chest X-ray or a CT scan can take anywhere from 15 to 90 minutes for results to come back. Even though POCUS is an effective tool, there are some limitations and risks that the APP should be aware of. Like plain film radiography, ultrasound waves are weakened by adipose tissue, and POCUS has limited penetration in morbidly obese patients. Also, prone positioning, surgical dressings, subcutaneous emphysema, burn injuries, and large pneumothoraces can limit POCUS's imaging ability. In addition, prolonged exposure to intense ultrasound beams can theoretically raise the temperature of the body site being examined by as much as 4 degrees Celsius, causing local thermal injuries. While the negative pressure created by sound waves as they pass through the body's tissues may pull gas out of the tissue solutions, causing cavitation or gas bubble formation injuries, and these are called mechanical injuries. Finally, in some animal studies, the air-filled lungs were susceptible to perialveolar hemorrhage with direct exposure to ultrasound scans using B and color flow mode. Because of these risks, modern ultrasound machines have mechanisms in place that are designed to reduce the risk of thermal and mechanical injury. Thermal injury is monitored by thermal index, TI, and it's to be kept below 1.0. Mechanical injury is monitored by mechanical index, MI, and for gas-filled organs, it needs to be kept below 0.7. Finally, as a good rule of thumb, it is prudent to use the lowest frequency possible for the shortest amount of time necessary to obtain an accurate diagnosis when performing a lung POCUS exam. Okay, just a quick Module 1 summary, because you may see some of these again. Frequency, or hertz, is the number of sound wave cycles per second. The typical frequency range in medical POCUS falls between 1 million and 15 million hertz, or 1 to 15 megahertz. POCUS is a goal-directed bedside ultrasound exam performed by a healthcare provider to answer a specific diagnostic question or to guide the performance of an invasive procedure. In POCUS, a handheld transducer is placed against the patient's gelled skin, and sound waves of 1 to 15 megahertz are emitted. The returning echoes are captured by the transducer, interpreted by the ultrasound computer, which then displays an image on the monitor. The 4 types of echogenicity are anechoic, hypoechoic, isoechoic, and hyperechoic. Anechoic tissues do not reflect sound and appear black on POCUS. These tissues include fluid, blood, bile, and urine. Hypoechoic tissues reflect more sound waves than anechoic, but fewer than surrounding tissues, and we use the renal cortex versus the liver as our example. Isoechoic reflects sound similarly to surrounding tissues and appear as shades of gray, and we use solid organs, soft tissues, and muscles. Hyperechoic tissues reflect most sound waves and appear bright white on ultrasound. And examples of hyperechoic tissue included diaphragm, pericardium, and the lung pleura. These next 2 slides are simply my references, and thank you for taking the time and energy to